Dementia describes a group of conditions that cause a gradual loss of brain function. It can affect your memory, intellect, ability to think rationally, social skills. Dementia is a broad term, not a specific disease. About 1 in every 12 people aged 65 years. While dementia is more common in older people, it is not a normal part of aging. Dementia is a progressive condition, it gets worse over time. In the early stage you have some changes in your thinking and memory but can still function well. In middle stage dementia, the changes to your mood, memory, thinking and behavior are stronger. You will start to need support from other people. In severe or late stage dementia, you may be unable to remember people, communicate, walk or look after your own hygiene. At this stage, you will need constant care. What are the symptoms of dementia? Memory problems, language issues, reasoning difficulties, mood changes. Your symptoms of dementia might not be obvious at first. You might have memory loss, changes in your planning and problem-solving skills, trouble doing everyday tasks, changes in your mood and personality, a lack of interest in things and activities you used to enjoy, poor judgment, problems with speaking and writing, confusion about time and place. What causes dementia? There are many different causes of dementia. Some of the most common causes are Alzheimer's disease. More than 1 in 2 people with dementia have Alzheimer's disease. Vascular dementia may happen after a stroke or untreated high blood pressure. Lewy body disease. Lewy bodies, protein, stop your brain cells from working properly. Frontotemporal dementia, caused by damage to either or both the frontal or temporal lobes of the brain. Alcohol-related dementia, dementia caused by regularly drinking too much alcohol. Chronic traumatic encephalopathy, a type of dementia caused by repeated head injuries. Younger onset dementia, early onset dementia, dementia in people under the age of 65 years. HIV-associated dementia. When should I speak to a doctor about dementia? See your doctor if you notice any of these warning signs, such as problems with your memory or thinking. Memory loss, you forget things that should be familiar, and still don't remember them later. Misplacing things, you might put things in the wrong place. Difficulty with familiar tasks, you might make a meal then forget to eat it. Disorientation of time and place, you forget how to get home. Poor judgment, you might make risky moves when driving. Problems with abstract thinking, you find it harder to understand your finances. Language problems, you forget simple words or say the wrong word. Or changes in your mood or personality. Changes in mood or behavior, you have rapid mood swings for no apparent reason. Changes in personality, you might become more suspicious, fearful, uninhibited or outgoing than before. Loss of initiative, you have become more passive or uninvolved in activities. How is dementia treated? Unfortunately, there is no cure for dementia. Many people living with dementia find ways to cope with their illness and improve their quality of life. General care and support. Good carers can help offer a safe and predictable environment. It's important to have carers who you can trust and who understand your needs. It might be helpful to make changes to your home. Adapting your home can help you feel less disoriented, safe, comfortable, independent. Medicines. While there are no medicines to cure dementia, some medicines can help with the symptoms. Can dementia be prevented? There are many possible causes of dementia. There is no known way to prevent it. However, you can keep your brain and body healthy by following a healthy lifestyle. This includes being socially and physically active, eating a balanced diet, quitting smoking or vaping. If you drink alcohol, drinking in moderation, keeping your brain active, looking after your hearing, avoiding head injuries. It's also important to manage any other health conditions that you might have, such as hypertension, high blood pressure, diabetes, cholesterol, depression, hearing loss. What do I need to know if I care for someone with dementia? Caring for someone who is living with dementia can be both demanding and rewarding. It's also important to take breaks to look after your own needs. Ask other family members and friends to give you a break from caring. You may also be able to use respite care. Planning ahead. It's wise to help the person you are caring for to plan ahead whilst they still have capacity. Encourage them to appoint an enduring guardian. Support them to write an advanced care plan. These documents will help everyone to understand their wishes on healthcare and other topics. Communication. People with dementia need to feel understood. Here are some ways of talking that can help people living with dementia feel supported. Validation therapy. Instead of challenging someone with dementia, build empathy by understanding their feelings. For example, if a person is waiting for their partner to come home, you can acknowledge how they feel and empathize with them. It doesn't matter that they don't remember that their partner has died. Music therapy. People with dementia often remember old songs. Familiar tunes can unlock memories and feelings. However, it's important to know their musical likes and dislikes. Reminiscing is a way of remembering past events, for example by reading an old letter or looking at childhood photographs. It usually triggers positive memories and feelings, even if they can no longer speak. A memory book can store photographs, letters, stories, and drawings. This can help a person who feels confused about the present go back to happier times. Thanks for watching. Subscribe for more such videos.